Hey everyone.
Look who I found.
Talking about me or the cat?
Both.
Hey everyone, hope
I
you
have
guys
my
are doing
two
well.
loves. This is Miso. He's been quite the hit.
He tried to commit suicide though. Yeah, he didn't get fed when he wanted to be fed, and he tried to literally jump from our second story yesterday.
Oh no. Pandemic mental health problems
Yeah,
for the kitty.
he's very angry. So he's acting up a little these days. I'm not sure if that's going on in your house with pets and people, but yeah, Miso's been acting up. So.
Well, he's here for emotional support and love. We thought we would answer your questions tonight, so we sent out a notice and have all sorts of interesting questions about OCD and PTSD and
And are you Lebanese?
yeah, that was one of the questions that came in. Are you Lebanese? This is not a Lebanese cat. This is a Burmese cat. Now, I don't think he's from Burma, but
No, he's Balinese.
Balinese.
Yeah, not Burmese.
From Bali?
Supposedly.
Wow.
I think it's,
No
who
wonder
knows?
he's so beautiful.
Yeah.
All right. So the first question was, are you Lebanese? And yes.
But the more surprising thing is, so am I. That's why you fell in love with me.
That was in the top 30. That was, yeah. We bonded over Syrian bread and kibbeh and
It's true.
baklava, and
So true.
had nothing to do with you were stunningly beautiful and smart, and
Aw.
sweet, and you were a nurse and liked to take care of people. Oh, I liked all those things. All right. Well, let's get more serious. Do you believe in giving people second chances after they emotionally
Very interesting
cheated?
question. So she said emotionally cheated, not physically cheated. So that's an interesting thing right there. So we're going to have obviously very probably different answers on this. I think it depends on the situation, and it depends on how hurtful and if it's repetitive behavior. But I think even if you don't stay with the person, that doesn't mean you can't forgive them, because if you don't forgive them, it hurts you, not them. So forgiveness is a huge, important thing in your life for your own emotional health. That doesn't mean you necessarily need to stay with someone or give them a second chance if it is something that's constantly destructive to you. That's my thought. So
I'll go with that. I always want to know why people
yeah. So the answer to
do
the
what
question
they
is
do.
why. Yeah.
That you often say that behavior is complicated.
Right.
Now, if it's hurtful to you, then
But there's
you
also
have
another.
to be careful.
There's also another part of this, and we've talked about this, and this is true also. Sometimes things that happen in a relationship, the behavior is a symptom of the problem and not the problem itself. And you want to be really clear about that, because if there's other problems going on, that it's not that it's an excuse. I'm not making an excuse. I'm just saying sometimes there's a lot of underlying issues going on that were already there, and it ends up sort of culminating in this other issue, right?
She said it.
But
What else can I say?
But do you agree?
Of course.
Okay.
My son has a TBI. What is the best treatment? So in the End of Mental Illness, my new book, there's a whole chapter on traumatic brain injuries as a major cause of psychiatric problems. And I put my patients, our NFL patients, for example, multiple vitamin, high dose, high quality fish oil, and a brain boost that works in multiple different ways. We use Brain and Memory Power Boost from BrainMD. And we also check out, make sure they don't have the Irlen syndrome, IRLAN, which is a visual processing disorder, common for people who have traumatic brain injuries, and then hyperbaric oxygen. It's a huge treatment that we love. What is CPTSD? I'm not sure what that is. PTSD, maybe CPTSD is chronic PTSD. So hello everyone, South Carolina, San Antonio.
Someone's asking what the cat's name is. The cat's name is Miso.
Yeah, that was a big fight here in the family.
She wanted to name him Seaweed.
Miso was a, what do you call that? A compromise name. I wanted to name him Shakespeare because he has such beautiful language. All right, moving on. Any advice on re-triggered PTSD from COVID-19?
That's an interesting one.
Yes, PTSD, whether it's from something in the past, the present pandemic has triggered all sorts of people who've had PTSD in the past.
You're cut off.
The news, the scariness, when you were in the stores that first week.
Yeah, it was people were literally acting crazy. They were acting a little nuts.
People got in a fist fight at the gas station. So any trauma can trigger things from the past that were traumatic. And I often say, let's help get the past out of the present. And so some of you know my dad died 3 weeks ago, 3 weeks and a day. And just having that image of them doing CPR on him and then his body laying there for hours, initially was upsetting, but I help people with trauma. One of the things that helps is something called alternate hemisphere stimulation, which is one of the basis of EMDR, a specific psychological treatment for trauma. And so what I did is I brought up the image and then grabbed each of my shoulders and rubbed down while I thought about the image. And then I put something positive in it rather than something that's upsetting. I put in just the image of how much I loved him and what a wonderful relationship we had the last 5 years of his life. And that stressful image turned into a peaceful image. And then last week, we're like going through all the pictures. I must have went through 10,000 pictures. And then all of a sudden I picked up the paper and underneath it was a picture of my dad in the mortuary. And I'm just like, holy smokes. And he was cremated, so nobody went to the mortuary during a pandemic. And initially it hit me and it started to bother me. And then so I did this and I saw him, because obviously I know he's dead, and I see him in a peaceful state and how much I love him. And a picture that really bothered me actually became very special to me.
Interesting.
And our therapist at Amen Clinics, Deb Silveria, she does our EMDR. She's very good. She has embraced virtual EMDR. So if you need help, please call Amen Clinics. Go to amenclinics.com and either fill out a form or call the call center, because we are there to help you. Someone from Melbourne, Australia.
I love it. When we first met, you saw my scan. Here's one thing that really helped me, because I did not believe in PTSD, ADD, OCD, psychopathy. I almost canceled my first date with you because I was
just let it all hang out there.
No, I was
people.
like, I'm not buying any of it. I was going to cancel my first date with him. And so he says it's because I didn't want to be psychoanalyzed, which is probably true.
Because she needed to be psychoanalyzed. My first gift to her was 10 sessions of EMDR.
Yeah, we were quite the couple when we first met. So, but what was so interesting and what was so helpful to me was when you scanned me, which was 2 weeks after we met.
Well, I wanted to know.
You wanted to see my naked brain?
Girl, or
It
you
never
want to
occurred that way.
let move
Yeah.
her on.
So, yeah.
And
so,
you passed.
My naked brain passed. Okay. So I passed the test. Apparently my naked brain was good enough.
You're really
and so,
focused on naked. Why is that?
because it was such a bizarre line. It was the most,
I didn't say I want to see your naked
pretty
brain.
much you did. So anyways, not my point. We digress. The point being that when I saw the scan, it was fascinating because one of the questions you asked me, you had asked me about emotional trauma that you saw in my brain. And I'm like, oh, here we go. I was just like not here. I was not having it. I wasn't hearing it. And I'm like, this is just crazy. I'm great. I'm fine. And you're like, oh, you mean fouled up, insecure, neurotic, and emotional? And I'm like, so we did this little dance for a while. But then, and I'm like, that's nonsense. You know, I kept trying to say it was nonsense. You asked me what happened in my childhood. And I'm like, okay, not doing this. And then you got to the point in my questionnaire you had asked me to fill out, and it said that I had, where it talks about health problems when you're a kid. And I had GI issues when I was a child. I had upper and lower GIs when I was 4. I was in the hospital constantly for issues. And that's when you said, so you went around, see, you're sneaky. This is why I don't want to date a psychiatrist, because you're sneaky. He goes a roundabout way. And he's like, so he starts talking about my GI issues when I was 4. And he's like, well, what else was going on at that time? And I'm like, oh, well, my uncle was murdered not long before that. And then we started talking. I just didn't even really think about it. And you just sat there and stared at me like you are now. You just sat there and stared at me. But my point with all of that is when I saw the scan and I realized you could actually see trauma. It wasn't this.
Your uncle was murdered in a drug deal gone wrong, and you vividly remember your mother and grandmother falling to the floor screaming when they found out.
And then 2 weeks later, the GI issues started.
But obviously,
No
there's
connection.
no connection.
No. So, but my point was when I could see it on a scan, it all of a sudden, because I'm an ICU nurse, and so that made more sense to me. When I can see something, it makes more sense to me. I'm like, oh, whoa, this is actually real. Like I could see it. And it was just very interesting. It made it easier for me to treat.
It wasn't sort of the only trauma, was it?
Well, I don't know. You tell me after we finish. I'm finishing my book right now, so.
It's wonderful. I'm so proud of her. It's coming out January 5th. It's
the relentless courage.
The relentless courage of a scared child.
Yeah.
And it's so good. Yeah, no, most psychiatrists don't look at the brain.
You're cut off.
It's crazy. We're talking to
Say
two
hello. We're talking to two
phones
cameras
at once, but I'm reading mine, and you can do an evaluation from Australia. You just can't get a scan.
Yeah.
Yeah. Here, we're working on how to do the Star Trek.
Right.
Not yet.
Beam me up, Scotty. Is that Star Trek?
Star Trek.
Yeah. Okay.
All right. What do you recommend for OCD? Getting a scan in June, and I'm worried.
If you have OCD, you would be worried about it. We've got 2 kids here with a little bit of OCD.
Yes, we do.
Yeah.
Their brains are busy. And what we discovered is that OCD
There you go.
is not one thing in the brain. That typically the classic pattern for OCD is the front part of your brain works too hard and you can't let go negative thoughts or negative behaviors. But that's not true for everyone, which is why you have to scan people. So you know your fingerprint, and that's your map that you get treated on, not you get treated because, oh, everybody who has this gets that. It just doesn't work. People are individuals. So typically with OCD, we want to raise serotonin and calm their brain. But what if you have OCD and you have a sleepy brain? If you don't want to calm a sleepy brain, you know what that's like. And that can actually hurt you. So
one thing I wanted to say about the PTSD was once I could see it, and we did the EMDR, because you were talking about EMDR, I was resistant to it until I saw it. And then I did the EMDR. EMDR is so helpful. It's just so insanely helpful.
So,
yeah.
Very helpful. Are there any good supplements to help people with OCD? So I think of things that increase serotonin. We make something called serotonin mood support, 5-HTP, and saffron, which has been found in 21 randomized controlled trials to be helpful for mood issues. And so I think things that increase serotonin, 5-HTP, saffron, L-tryptophan, exercise as well could help.
And one thing that's really interesting, so people tend to, if they don't really understand what they're taking, people tend to think, well, supplements are harmless, and so I'm just going to try a bunch and see which ones I like. It's interesting when it comes to like nootropics. You have to be really careful about doing that. So highly recommend you take like our questionnaire, figure out which ones might be best for you. Let me tell you why. Because if you have a sleepy brain and you take something that stimulates serotonin, right? So for me, I have a sleepier brain. When I take our supplements that stimulate more serotonin, I feel drunk. And without knowing, I didn't take Chloe's.
But she's way nicer.
But I don't like it. So I feel foggy. So but Chloe, our little one, when she was young, she has a little bit of OCD. When we scanned her, we realized she had OCD. I thought she had ADD because it was sort of presenting that way. When she gets really anxious, she shuts down. And so I gave her one of our supplements that was for ADD, and she just got more anxious. So we ended up scanning her. So don't just take them. Actually figure out what's going on with you.
And our online assessment is called the Brain Health Assessment. You can go to brainhealthassessment.com, and that can sort of give you a sense what your brain type is and what supplements might be.
Don't just assume that because you have a certain brain type, your kid's going to be just like you, or that someone in your family is going to be just like you.
Another question is, how do you improve your circadian rhythm? And getting on a schedule during the pandemic is really important. And I think we've actually been pretty good about getting on a schedule, sort of getting to sleep by 10, sleeping sometimes till 7:30.
Oh, I love it so much.
Getting in a rhythm and routine. She's actually trained me to make the cappuccino in the morning.
You're so trainable.
She's like, oh, you just do it better.
He does.
Completely lying. It's her way of
That's how you
out
get
of
your
it.
husband to do nice things for you. Tell him he's good at it.
And you think I'm manipulative. Anyways, another way to reset your circadian rhythm is this light box. Whoa.
Bright light therapy.
Bright light therapy, half an hour in the morning. Don't look straight at it, that'd be bad. But just have it about an arm's length from you, and that can really be helpful. You can get the bright light, it's called Bright Minds Light Therapy Box at BrainMD. It's not a commercial for BrainMD, but when they ask, this is what we use to light the set.
Well, you started carrying it for that reason.
So another question from Chavez is, how do we change what we believe? Do you have an answer?
Well, you go first.
Well, the first thing is you question what you believe.
That's my favorite.
You don't have to believe every stupid thing you think. Thoughts lie, they lie a lot, and it's our uninvestigated questions or beliefs that often ruin our lives. And so the exercise we had, I did it with a patient today, actually with 2 patients today, is whenever you feel sad, mad, nervous, or out of control, write down what you're thinking. And then ask yourself, is it true? Can I absolutely know if it's true? And learning how to question your beliefs is just so helpful.
Those 4 questions, the 4 questions we like, and we credit our friend Byron Katie as well. So I love these 4 questions. Is it true? Can I absolutely know it's true? How do I feel when I have that thought? And who would I be without the thought? And then you turn the thought around at the end, which is turn it to its opposite. Are life-changing. And one example I love to give is, if you take a thought that's torturing you. So when my daughter was really young, she was a hard child. She's an easy teenager because I learned how to be a better parent.
Easier.
Yeah, no, she's a good teenager though. And we are so bonded. We are so close. But when she was little, she was hard. And there was this one day where we were getting ready for school, and she just went, she had this full-blown tantrum, and I kind of lost it. And I didn't say it out loud, thank God, but in my head, I thought, oh, she's just like her dad. And I got really angry. And I realized how toxic that thought was. And when you have toxic thoughts, they leak onto other people.
They lead to toxic behaviors.
Right. And so now it starts to affect your relationships, and they leak onto other people. So I did that. I spent 2 hours doing that exercise. Who would I like? Is it true?
So is it true?
Can I know that it's true? No, of course I can't know that it's true. Yes, she's like both. Like, she's not just like him. She's like a combination of everybody.
How does that make you feel?
It made me feel angry, helpless, sort of stuck, and like we couldn't figure out our problems, and resentful, but then guilty, and like all these like swirling emotions because I'm a mother. I'm supposed to be better than that. Like all these crazy thoughts I was having.
And who would you be without the thought?
I'd be a better mother. I would be more free. I would be more peaceful, more able to work on how to communicate with her, right?
And then you take the original thought and turn it around to the
This is the catch. My daughter's just like me. And it just instantly made me laugh. And I realized she's just like me. I'm very stubborn. She's
really?
Yeah, and she's intense. Yeah.
Oh, when you two get going. We were talking about something this morning, and I'm like, can you just tone it down a little bit?
But we were excited. That wasn't even us arguing.
I know, and it's stressful. Okay. Yes, you can change beliefs. And is OCD, anxiety, something you can overcome, or do you always have to manage the symptoms? Well, I used to be terribly anxious. I was really anxious when I was young. And I'm not terribly anxious now. I mean, unless you're upset, then I get anxious.
But when people ask this question, I find it interesting. It's like, will I always have to manage it? When I think of that, I think, well, will I always have to exercise? You know, you exercise because you know it's good for you. Managing your mind, managing your thoughts, managing your emotions should be a lifelong practice for all of us, not just if you suffer with something, but for all of us, because all of our thoughts can go a little bit haywire. So it should be like exercise, you know, or brushing your teeth, because it makes you happier. It makes you more settled. Yes, no?
Yes. And sometimes when you do it initially, it hurts.
Mm-hmm.
Like if I haven't run for like 8 years, and then all of a sudden I run a mile, I'm like in terrible pain.
Mm-hmm.
But the more I do it, the easier it gets, and the better it makes me feel.
Mm-hmm. Yep.
How to keep the mind calm, which is basically practice over time.
Yeah.
Meditation
For me has been a lifesaver.
Diaphragmatic breathing, all those things.
Meditation and prayer and breathing for me are just lifesavers. But exercise too.
Somebody's saying we seem to be bonding during this pandemic.
Oh, we were talking about that. We are so grateful that we have not had issues. We've had sort of bumps we have to fix and things, you know, with kids here and there, but we have not had that. We've had our moments where we give each other, our rule in the house is people are allowed to have one temper tantrum a week. and for the first 2 months, we didn't really have that. And then all of a sudden I started to get a little itchy. I'm like, I don't like people telling me I have to be home. So yeah, I had a temper tantrum, but But here, let me tell you why.
We're in this like 12 weeks now, so she's got 10 more tantrums.
Let me tell
before
you
I
why.
get upset.
But let me tell you why it worked out okay. Because you're really good at not reacting. That's a really important thing. I get frustrated about something and he just doesn't react. And he's like, okay, sweetheart. And it gives me, it's like putting a mirror in front of me and it gives me a minute and I'll come back and go, I'm sorry. Like, I know I'm acting silly, but it's you're not reacting. That doesn't give me anything to react to. Just FYI, guys or girls.
What's your opinion of antidepressants? That is from Anonymous. Who would name their child Anonymous?
Anonymous.
I don't know. I think for the right brain, antidepressants can be super helpful. But for the wrong brain, they can be
Or the wrong
terrible.
antidepressant for the wrong brain. It's part of my book.
And so I think knowing your brain type, that's why the imaging is important, or if you go to brain health assessment, it helps match the medicine or the supplement to your specific brain. How to overcome fear. Now, let's be clear. Some anxiety is good.
You have fear for a reason.
Tana threatens my life virtually.
It's my
on a
way
daily
of telling him I
basis
love him.
Don't mess this up.
You can't mess it
There
up.
will be problems.
There will be consequences.
There will be consequences.
Yeah. You don't get to leave.
You don't
Till
want,
death do
you
us
do
part.
not want no fear. You want appropriate fear. The people who had no fear were on Miami Beach in the beginning of the pandemic. No, the people who die early, the don't worry, be happy people, die the earliest from accidents and preventable illnesses.
So one of my favorite books, and I actually keep a stack of them and give them to young girls all the time, my nieces, my daughter, my daughter's friends, is called The Gift of Fear. Now, it's a little bit of a different topic. It's how you use fear to protect yourself, right? But the point being, we have the gift of fear for a reason. It's there for a reason. You don't necessarily want to eliminate it. You just want to put a leash on it. You want to learn how to manage it.
So you want to be able to have appropriate fear, but good frontal lobe function, so you can make the best decisions. And back in early March, when this pandemic started, I kept telling myself, are you going to be proud of how you acted in September?
Yep.
So think of the long-term outcome, not just this moment.
And if you're okay, your kids are okay, your family's okay. If you're not, they will follow your lead.
And one question is, do we believe we can heal the brain without pharmaceuticals? Absolutely. That you were not born with a Prozac deficiency or a Ritalin deficiency. I think, but you have to put the brain in a healing environment, which means you have to eat right and exercise and manage your stress and fix
and one of the things I love about our work is that it's more about getting to the root cause. So if you are having brain issues, it's like getting the right nutraceuticals or figuring out what the cause is, or if it's a brain injury, or if it's Lyme disease, or if it's whatever it is. Getting to the root cause is just so important, rather than just constantly slapping Band-Aids over it with a different medication.
Well, and that's what medicine has turned into, and you've seen it during the pandemic. Everybody's like, when's the vaccine coming, or what's the medication, when your best defense against COVID-19
Is your immunity.
Is your own immune system. And even though the United States has only 4% of the world's population, we have 34% of the world's cases and high mortality. And why? It's because we're sick as a society. The risk factors for mortality are at epidemic levels here in the United States. Obesity, diabetes, hypertension, inflammatory illnesses. We need to do a better job of getting healthy. All right.
Does that say, did a workshop on the book? Yeah, The Gift of Fear. Yeah, great book. Highly recommend it.
do you have any final words for
We
our
just
group?
want to check in with you guys and see how you guys are doing. So we would love to hear from you, get your questions. Thank you for sending these. Hear how you're doing, and repost this if it's helpful to you. But tag us, please tag us.
So, a question on how much vitamin D3. I take 7,000.
I take 8. Yeah.
Units a day. That keeps my level at high normal.
I take a lot of vitamin C. So it's interesting. We did
Oh, we have NeuroC. Oh my God,
Tastes
it
so
tastes
good.
so good.
It's liposomic.
I never think about supplements except to take them in the morning. Took them this morning. But when I take NeuroC, it's so good. I actually begin to think about it during the day. And now that we're bringing it up, I'm going to have to go get another 1,000 milligram hit of it. Wait, there was another question.
So one thing, but wait, while you're finding it, one thing, we did a podcast today with someone on some supplements, and it was really interesting. He said, why, when you started your journey, did you just sort of get this? Why did you jump in and become such an advocate for your own health with nutrition and supplements? And here's why. I take a lot of supplements and I do a lot of things for my health with, exercise, nutrition. And the reason why it wasn't that hard for me, I'm a little intense anyways, and I tend to jump into things. But the reason why was because after being so sick and being on 9 medications, I realized I would rather figure out how to eat, and I'd rather take a whole handful of supplements a day that don't have side effects than take a few it wasn't a few, it was 9 medications at the time. 9 medications that had a lot of side effects. So figuring out for me what that root cause was and helping to take the things that healed my body and give my body the opportunity to boost its own healing potential, if you will, boost my own immune system, was so much better, even though it's a lot of supplements, than taking medications that made me feel awful. So that's why I'm so intense about it.
And there you have it. We wish you safety, health, happiness, peace. We'll talk to you again soon.
Take care, guys. Bye-bye.